not leave out the end user, the health worker that is pivotal to the success of this health service delivery. And in particular, also, the health worker is pivotal to the core business of the Ministry of Health. And so we felt that we needed to engage. But as we do this engagement, we also show some of the new features that we should look out for, that we optimize the value that they have. And there are quite a number of these features that have been added on board. But I'll let Kuani Banda to just walk us through. So Mr. Banda Kuani is our clinical health informatics specialist at IHM, and he's a health worker by profession who has added this informatics role. And so we together work to bring on board the perspectives of the end user to ensure that your concerns as health workers are actually central to the development of this software, as opposed to leaving out health workers out of this this development process. So I think I will end there for now, and just wish to invite Kuani to come through and just take us.
Good afternoon, everybody. And thank you, Dr. Miti, for that preamble. My name's Kuani Banda. I'm the clinical informatics specialist at IHM. And this afternoon, I'm here to take you through just a quick view of the features that are in the new version of SmartCare Plus 1.5, as we are terming it. Just a quick brief history. SmartCare Plus is an enhanced version of SmartCare. It was implemented in 31 facilities in Zambia in 2020. This year, there is going to be a scale up of up to 100 facilities and or more. So we have enhanced some of the features that are in SmartCare Plus to conform to the MOH guidance, and just to also conform to the changing guidelines, be it PEPFAR and MOH. So allow me to share my screen. So for those of you who have never seen SmartCare Plus, this is SmartCare Plus. This is the homepage for SmartCare Plus. I'm using the test installer, so all clients that I'm demonstrating on are actually test clients. I'm not actually using live data. So I'll proceed to log in. Okay. I will not go through the entire registration process, but it's very similar for those. It's very similar to that is in Legacy, but I'll just proceed to show you the features that are in 1.5. So I will start the visit. The reason for a visit, the test case for this child is I want to demonstrate this child as a child who was tested positive and is being initiated on ART. So reason for visit, I'll just say child is unwell. To see clinician. Okay, the child, this is the initial visit. I will assign it to the default system, as this is a test instance. Okay, I will search for that child again, child, just to ensure that the child is there. So that the child was called child test. Of course, we do have the service queues, but for demonstration purposes, I just want to demonstrate the new features that are in SmartCare Plus. So the first new feature or an enhancement, I wouldn't call it a new feature, an enhancement, is the HTS visit. So in the previous SmartCare version, or the current one, which is currently for the 31 facilities, and in SmartCare Legacy, we could undertake a test without verification, without consent. So we have added clinical business rules to ensure that we have adequate and clean data when it comes to HTS test. And another feature which SmartCare Plus has, if I could just scroll down to the ART services, as you can see, I want to initiate this child on ART, but I am not able to access any of the ART forms. That is because this child does not have a positive test. So the child is supposed to have a positive test before the opening of any of the ART forms. So I'll have to have a positive test so that the forms can be accessed. I'll go ahead and undertake a HTS visit. This child is 1 year old, so they're eligible for a serological test. But of course, we do have PCR in the system, but the date to last month. Okay, the client type. This is a new client or a non-PMTCT child. You could actually apply whatever is applicable to the client. I'll move on to details. The visit type, is it index, PMTCT? As we all know, that CICT has replaced what was previously known as VCT and PrEP. Okay, I'll do came via under 5 or OPT. I'll put that under 5. I'll / this, of course, you can put according to the ministry standard in the HTS register. Of client, is this a client urban or rural? And of course, the reason why this child is undertaking a test, which is sick. After I conduct, apply. I will proceed. The client's most recent visit or recent result, this client has never had a test, so I will not look at that. And the client doesn't have a partner status because it's consent. For those who already have SmartCare Plus in their facilities, you'll notice that the HIV diagnosis and the clinical visit are not present right now. Those two, this child. That is because I would have to consent, be it the actual client or the guardian for this client to consent to the test. Only with that, and I apply that, will the clinical investigation and HIV diagnosis be applicable and appear. So without consent, so that's another clinical business rule we've added. Without consent, you will not be able to conduct the HIV or HTS test, and that way you also will not be able to access the ART forms. So it's actually flowing clinically. We have clinical investigations. We have our quick picks. These quick picks, as you can see, are the most commonly used tests in this in the module. So these quick picks will actually vary according to the module, as I will demonstrate in the pediatric ART. So as I said, this child is over 1, so is applicable for a serological test. I will order determine, and this determine I'll enter the details. Sample collection date was today. Okay. And since this test is done right there in the HTS room, it's at the facility, I will then proceed to enter the result. I will add as a positive. Are the results acknowledged? Yes, they are, because usually, as we all know, using the HIV testing algorithm, the counselor or the provider is one who actually acknowledges the test. Okay, just give me a minute, it's frozen. Okay, I'll go back to consent and apply. I'll do the determine, so I'm sorry for that. HIV, I'll do a positive result and apply. Oh, it's giving me an error. Okay, I'll do the consent. I'll try the PCR. Test result detectable. Okay. So I'll just use a PCR because the determine was giving me an error, but that's obviously will be fixed. When that is done, the HIV diagnosis, one other thing that we have changed in SmartCare Plus 1.5 is that the diagnosis will not be able to, you will not be able to enter the diagnosis by yourself. In the current implementation of SmartCare, you can actually put negative yourself or positive, but this time it will determine, so if we have determine and bioline, which is reactive, it will be auto-populated as positive. If we have one negative, one positive, or one negative, it will be negative. And then we'll only be able to apply the HIV type, which of course is gotten from the bioline or from the lab. So I'll just give, for demonstration's sake, I'll give this child HIV1, just for demonstration's sake. And the results were given to the client or the guardian, apply. And then the referrals. So these are the referrals. Of course, we want to seek HIV care immediately because the child is reactive. Since the child is reactive, the next visit date will be on the same day. And then I'll go ahead and if I'm satisfied with my data entry, I'll go ahead and finalize. For those who may not know, the difference between save and finalize in SmartCare Plus is that save is saving as a draft. That means I could go back and edit it. Just give an example. That means I could go back and actually edit this interaction. But if I finalize, that means the data will be persisted to the database and will not be editable. If I go ahead and finalize, I will be able to view the interaction, but I will not be able to change anything. All I can see is the actual data that was entered. I will not be able to change any of the data if it is finalized. So that is how we undertake the HTS in SmartCare Plus. Just some of the clinical changes that we've added the clinical business rules. And if you may notice, I may not go back anymore because the client is reactive. We had issues, data issues emanating from SmartCare Legacy and SmartCare Plus, where you could have a positive client, they're initiated on ART, and then somebody will go back and enter a negative result. If we enter a negative result, that is another way, or there's another way of doing that, but that will be demonstrated later on, but not using the HTS visit. Then if you can recall, I was not able to access the pediatric forms. As you can see right now, the initial history and physical uninitiation is actually active. So these forms have been updated to the new version 4.5.4. You may notice in the adult that that means that there is no There is the eligibility form, the initiation form, and the short visit form have been removed. And we have included the stable-on care, but the stable-on care only applies to the adult. But right now, I'll just go ahead and just demonstrate the pediatric initial history, physical, and initiation. So I know people call it PIHAP, but now it's PIHAP-B because there's an I at the end. So this is, I will not go through the entire form per se. It's a typical, it's just, I'll just give you some brief highlights. Vitals are mandatory. When we say mandatory, if we're not able to, for example, if I'm at a facility and the thermometer, the battery is not okay, or there's no thermometer, instead of having the temperature down here, we have the reason why, the vitals, we have the reason why, or the actual vital itself. So that is mandatory. So either you actually have the temperature itself, or you have the reason why you do not have, why you have not implemented. As you can see, the reason why has been grayed out. So this is for the vitals. Okay, I'll go. Is as it is on the paper. I would like just to demonstrate the HIV test done. This is as you can see, the test done was this date, and it's supposed to show that, as you can see here, it shows the type of HIV. This is auto-populated from the HTS. So there is no need to redo this. It's auto-populated from the HTS. So if we conduct our HTS properly, we will have the adequate result here. Okay. I'll also demonstrate the quick picks, as I stated earlier on, that the quick picks vary according to each module. And additionally, the more of each test you do in each module, the system will automatically pick up the system will automatically pick up the most common clinical investigations. So they'll be added to your quick picks automatically by the system. Okay. We have a plan. Of course, this is exactly as it is on paper. We do have EAC, but that is later on. We have advanced HIV care as well in the plan. And then in the investigations, we're still currently just firming up the baseline viral load. So the baseline viral load will be different from the actual viral load, as it will be done only when a client is being initiated, and it will only be applicable when a client does not have a dispensation. If once a client has any ARV dispensation, the baseline viral load will not be active. And then I want to bring your attention to one of the great features of SmartCare Plus 1.5, which is the ARV prescription and dispensation. So for the ARV prescription, usually would have in the current implementation of SmartCare would have to do it one by one. Each drug by its own would have, for example, ABC, 3TC by its own, and LPVR. But as SmartCare 1.5, we really want to make this version easier for the clinician to use. So we have added the standard prescriptions and included the prescriptions according to their weight. So this is for pediatric ART optimization. So we will not, instead of instead of having the, for example, for a clinician who's prescribing, he or she doesn't need to have a chart according to the Okay, according to the weight bands which are already on paper, in SmartCare Plus, we have actually implemented the standard prescriptions for the pediatric ART. For example, if this child, although I didn't put the weight, I'll just give an example. If this child is 7 kg and is on the first line, as you can see, we have first line and second line implemented in the system. We just quickly 7 kg, I won't have to start doing calculations. SmartCare has already done that. We'll just quickly highlight this 7 kg, the ABC, TTC plus a DTG, which is the first line for 7 kg, and it's auto-populated. All I have to add here is the duration of the drug. So if it's for 30 days, if it's for 15 days, that is all I would have to add. Then I can confirm changes and close. And there we have optimal prescription and dispensation in the system. For non-ARV drugs, of course, would search from the non-ARV drugs. So these are limited to the non-ARV drugs. But the ARV prescriptions are limited specifically to the ART prescriptions, and this is for, and we have aligned them to the first line, second line, and aligned them to the actual weight bands for the first line, second line, according to MOH guidelines. Okay, of course we have our referrals as well. I can just go ahead. I just wanted to demonstrate that. I will not say that I haven't finished the entire section. I just wanted to just show you one of the features that SmartCare Plus has, which is one of the great features, which is drug optimization for prescription for pediatrics and adult. Any questions now? Okay. Before I go into the adult ART, I'll allow for some questions.
So dear Netek, if you have any questions, kindly raise your hand using the raise hand feature. Then you can kindly go ahead and ask your question.
Nathan Sinyangwe, you raised the hand for some time. You can proceed and ask your question.
Okay, thank you very much, Dr. Miti, and thank you very much for the great presentation. I did write my question on the chat, but maybe it may not be so clear, but now that I have an opportunity. Thank you very much, yes, for the HTS module that you did just demonstrate. And so we've noticed with SmartCare Legacy that the moment you just finishing recording a positive result, it will bring pop-up to tell you that this child is HIV positive and needs to be initiated. And that pop-up will always come up until you start a child on ART. Otherwise, you always get that reminder. Then so does it mean that SmartCare Legacy will not have those reminders? Because even for children that are actually below 2 years, those that are still under option B+, in SmartCare Legacy, if you run actually the first test, could be at birth or at 6 weeks, and then you also update HTS on the next subsequent visits. For as long as the child has not seroconverted, which means they'll still have a negative result, you always again get a pop-up reminder to say this child is due for the next EID test. So I noticed that the child that we did work with is below 2 years. I was also maybe expecting that perhaps we'll have a pop-up of a reminder to say, hey, this child is next for the next EID test. So does it mean SmartCare Plus will not have these pop-up reminders? This was my question. Thank you. And the third question, I don't know if this will be demonstrated. If you also run HTS for a child, either positive or negative, then you do the association, which is a binding. I've noticed when you come to the mother who is HIV positive and try to click on the relationship or the association, Yes, the children bound will appear there, but I've noticed that for some, it will not indicate whether the child has got a negative or positive result. Thank you. These were my submissions.
Thank you, Kwame. You can proceed and respond to that question.
Thank you very much. I should think the first two just really deal with pop-ups or reminders. So for the pop-up implementation, yes, we are currently undertaking how to best implement pop-ups in this current system. As you have stated, in legacy, we do have those pop-ups. In SmartCare Plus, we want to make sure that when we do implement something, it will stand the test of time and it will be clinically correct. So the pop-ups will be implemented, and there'll be a bit more, there'll be a different than the way they are in legacy. This time when you do, for example, have a pop-up, when you click on it, it will directly take it to that module or that testing modality that is on the pop-up. So yes, we are going to implement pop-ups in the system, and that's something you look at when the system comes out. For your second question, or your second or third question, which is the HEI, this client I was demonstrating was not an HIV exposed child. I was just demonstrating a child who was 1 year old. I would definitely explain something concerning the HIV exposed children, because we do have a feature which is not in legacy, which I will demonstrate later on. So more or less that question will be answered when I demonstrate the PMTCT module, which includes the mother and the child. Thank you very much.
Thank you very much, Kwani. So in the interest of time, I'll ask that you still proceed with the other features that we need to show, and then we'll be able to take some additional questions very soon. Thank you.
Thank you, Dr. Niti. I will just go ahead. Mind you that this is a test instance, so these clients are already are not real clients. I'll just would like to demonstrate the prescription when it comes to an adult. I did demonstrate the pediatric. So let me just demonstrate the prescription when it comes to the adult. Okay, this is the prescription. So these are the standard approved first line and second line prescriptions in this by MOH. So instead of going one by one, scrolling down, one click, that's what it takes. Next, if it's 180, and we are good to go. Go to the pharmacy. That's how much it is of ease. Of course, we also do have DSD. Just to talk about the ART functions, we do have DSD in the system as well. And we also, I was also talking about the EAC function. So the EAC function, as it's been implemented, will actually have a separate EAC module or card in the clinical follow-ups. It will only be activated when a client has 1,000, the viral load of 1,000 copies and above. And it will only be deactivated when the subsequent or the future viral load is below 1,000. So we do have EAC, and when I demonstrate the report, you'll see how that translates to the enhanced viral load report. So I just want to demonstrate the adult. Allow me to, just a female, okay, female. Allow me to demonstrate a feature which is not in legacy, is exclusive to SmartCare Plus, which is the PMTCT. So as we know that in tracking the clients, which are option B clients either from ANC and the transition to postnatal, we actually use the actual form itself, which is the antenatal and the postnatal. But now in SmartCare Plus, we've actually added what we call the PMTCT follow-up form. So this form will only be activated once a client has a positive HTS result in ANC or in postnatal. The form, so as you can see, this client, the form is activated. If I scroll down to the HIV diagnosis, there's a positive result there. Sorry, if you don't see, there's a positive result here. And that's why the form is actually activated. Without a positive result, the form will not be activated. So this form is basically the tracking form for all mothers who are HIV positive. It's basically the clinical follow-up for mothers who are positive. So from now on, we'll be using this form. It's basically the same as the ART form, and it tracks the woman exactly, including all the ART features which are in the mainstream care, into a form which directly deals with mothers. Okay. And we have all the standard, we have DSD, and we also have the standard prescriptions as well in this form as well. So I just thought I would demonstrate the PMTCT form is a new feature which is activated. It's in ANC. You will also find it in labor and delivery, and you will also find it in the postnatal module. So we can adequately track these women from antenatal up into labor and delivery, up to postnatal until the 24 months, then when they are transitioned into the main HIV care. So we actually have a specific form for these women. That is the PMTCT form. Okay. Allow me to also demonstrate the HIV exposed child form. Okay, this is a child who's 2 years old. It's in the under 5 module. You will find the PMTCT follow-up form. Okay, so this is for HIV exposed children, not for those who are actually seeking care. This is for the HIV exposed infants. So this form is specifically for those infants. Okay, and in this form, we have the testing profile. So we can actively track the testing profile. This will be auto-populated. If they're tested at birth, yes. Tested at 6 weeks, 6 months, 9 months, 9 months, then we go into 12, then not, and then 18 up to the final outcome, which is the 24 months. So we have made tracking of the HIV exposed children much easier because we have a specific form, this is a MOH approved form, so that we could actually track PMTCT women or option B plus women, and we can also track the HIV exposed infants. Okay. Okay. I will also quickly navigate back to the adult ART. Okay. Just to highlight something that I may have missed earlier on, that as I stated earlier on, you will not find the ART eligibility form. You will not find the ART initiation form, as that has been with test and treat, and the initial history and physical and initiation has got up those forms. So there's no eligibility, there's no initiation. That is done in the initial history. We have the patient locator, the clinical follow-up, and then we have a new form, which is the stable on care. the ART stable on care. I'll just demonstrate that stable on care. So this ART stable on care, for it to be activated, will have its own MOH approved guidance to activate this form. You must be virally suppressed twice in a row. And for you to actually access it to be stated as stable on care, it's basically a form which just speaks to the stable on care clients. Of course, it has its DSD as well. Of course, we have the DST because these clients are stable on care and they're actually applicable for DST. And we have the standard prescriptions as well in the stable on care form. Okay. So I go back. So I'll repeat. This form will have a special implementation, and it will not be accessed by anybody, including somebody who has just started ART. I'll just demonstrate the registers quickly so I can have questions. I'll just quickly demonstrate just to have eyes on some of the registers that we have implemented in the system. Some of the new registers. I will go to reports. I want to demonstrate the ART register. Of course, we do have the ART register in legacy, but with this implementation of SmartCare Plus, we decided we did our business analysis and we wanted to make things easier for the clinician, the data manager at the facility. So we came up with a register which we thought would speak to the current the ARV spectrum, the HIV spectrum in Zambia. So I'll quickly go through the ARV register. Mind you, I repeat, these are just clients. So we have the new PIN, of course. We have the new PIN, and we do have the ART number. Let me quickly add filters so that will make it easier for us to navigate this register. We have the new PIN, we have the ART numbers, we have the date of birth for the client, the age, and we have the age category. So we have added the age category. This category, so this is in conformity to the MER, the new MER, the 2.6. So we have 50 to 55, so 50 to 54, 55 to 59, 62, and as to 64, and 65 above. This way we can also, you will see where I'll actually demonstrate how this can actually be used when actually trying to get indicators from the facility. We have the first name, last name, the sex, of course, the demographic details. Oh, it's not showing. Oh, I'm sure. Okay, sorry, I was told that it was not. It was not showing the actual register itself. Okay. I'm sharing the, okay. Sorry for that. I was told that the screen was blank. I'll go through it again. We have the new PIN, the ART number, date of birth for the client, the age category, according to, we've put this according to the PEPFAR MER 2.6 TX-CAR age category. That means it goes up to 65. We have the first name, last name, the demographic details, of course, the sex, the mobile number, and the address for the client. Then this way starts getting interesting. We have the date the client was tested positive in the ART register. So we can actually track, for example, if I wanted to know how many were tested positive in, for example, in January 2022, if there are any, okay? So for 2022, we only have one because this is a test. Instance. But of course, in your facilities, you can actually just filter the month of which you want. So for this one, we only have one who was tested positive in April. That was a few days ago. So you can actually filter those who were tested positive in any date. Then we also have when they were initiated on ART. We have the date here when they were initiated on ART. We also have the treatment duration in months. How long have they been on ART in months? Okay. Is the client breastfeeding and is the client pregnant? These are the female-centered indicators. Right now, I do not have any in my database, but of course, you may have some in your database. So we have, is the client pregnant or breastfeeding? If it's yes, it will display yes. Then we also have the prophylaxis section, which deals mostly with the prophylaxis. And one of the added features of this register, we have the prophylaxis start date. That means we're talking about TPT. So INH, when was INH first given? For example, I have this client here. They were given INH on the 6th of February, 2020. Then we have the next indicator, which is the completion date. So we can actually track TPT coverage with one register. We don't need to have an additional register to have a TPT register, one register. And by the way, as I said, we can filter. So you can actually filter any of these indicators. So for a completion date, this is only filled out when a client has a dispensation of 180 tablets of INH. So if, for example, if in the system you only dispense 90, but then when you gave them the additional 90 without recording the system, you will not have a completion date, excuse me. So this completion date is only applicable when the system has a standard dispensation of 180 tablets, which is the standard dispensation. And then we also have the eligible for TPT after 3 years. So after 3 years, so if, for example, if the client completed in 2019, the TPT, let me see if I can find one, although this is okay, can I find one? Yes, oh, there is no yes here. But if someone completed in 2019 and they're eligible for TPT at 3 years for that, the 3 HP, it will actually say yes here. It auto-calculates after 3 years after completion date of the initial TPT, and they'll be eligible for the next TPT. So you can, for example, I'm at a facility, I want to know, this month, how many of my clients are eligible for the TPT after 3 years? You can just filter this and we'll have the answer right there.
Kwani,
yes.
I know that it's a very interesting presentation. I just want to remind you that we are remaining with just about 10 minutes.
Okay.
Thank you.
Okay, thank you, Doc. So I'll just quickly go.
We can wrap up in about maybe 4 minutes or so. Then we'll leave the other 6 minutes for closing and questions.
Okay. Well, thank you. Okay, we have the dispensation quality. So, for example, I want to know how many clients have 180. Okay, just give me a minute. Select this. Have 6 months dispensation, and we actually do have the MMD right here in this actual report. We don't have to go to an linear report. It's there, 6 MMD. We have 3 MMD. That classification is already in this report. So in case of doing that, I can also just come here and do a quick 6 MMD. And I'll know if a client has been spent 6 months. Then quickly, I'll just say this ART register is for anybody who has ever studied ART. But if you want to know the current TX car, all we have to do, we have a we have a way where we can actually just say, is current on TXCAR? We just click on yes, the yes. So these in this database, these are the clients which are currently on TXCAR as of running the report today. We have we also have the viral load result in this same one report, the most recent viral load result and the date. And if the client also has a patient status, if they're transed out, in case they were transed out, and the event date. If I have just a few more minutes, I'll just quickly demonstrate the implementation of, just so people can have a look at it, the implementation of the enhanced viral load register, so that people can just have a look at it. Okay. So this is another register exclusive to SmartCare Plus. You sort of what we did as at IHM, we integrated all the viral load registers and reports in legacy and made them into one consolidated register. Okay, it has the demographic details, including the last visit and the next clinical visit, the next pharmacy visit as well. It also has the baseline viral load, which I spoke to. Okay, the date the sample was collected and the result, the date the result was entered. We also, if this client moves on to the routine, which is every 6 months, then every year, if the viral load is suppressed, we have that. And in case the viral load is high, for example, this client I have, the client has a 16,000, what's his result? We'll go into targeted, and this is where we have the EAC sessions as well, EAC session 1, 2, and 3. And if in case there's a regime switch, in case the client is not responding to the drugs. So this is what we're deeming as the enhanced viral load register. So it speaks to everything that relates to the viral load, baseline, targeted, and EAC as well. Thank you very much. I'll allow for questions.
Thank you very much.
We have hands.
Sorry, is there any hand? Annette? Okay, we can start with Annette. You can see the hands. There's Annette, there's Andrew. Any one of you can go first.
Good afternoon, team. Thank you for the opportunity. So my question is, will SmartCare Plus have a function or a daily activity register for ART? What I've noticed is when you dispense drugs using a legacy and you try to run the DAR report, you get a blank report. Doesn't bring up anything. Thank you.
Can I go ahead and ask? Sorry.
Yeah. Yes, let's take all the questions together. You can proceed.
Okay. Thank you very much. My name is Annette. My question is on, for our women living with HIV, it's in relation to cervical cancer. I know currently, please correct me if I'm wrong. I'm sure you're the experts. Currently, we don't have a form where we can save cervical cancer interaction in SmartCare. So what happens at the facilities is that a lot of the appointment information is stored in physical register. Function that SmartCare Plus is coming with, I think it would be easy if the same way they can print out an appointment list for drug pickup or clinical visits, maybe we can do the same for cervical cancer. Thank you very much.
One more question.
Maybe refer to the chat first.
Okay, let's just see the chat.
Okay. When you can proceed and answer the questions quickly, then
Okay.
I'll read out what's.
Okay, thank you, Dr. Miti, and thank you for the questions. For the daily activity register, so I can, I'm glad to inform you that right now, SmartCare is, IHM and SmartCare, we are currently working with the ELMS platform, and we are currently trying to implement what we call the Health Information Exchange platform, where SmartCare Plus will be integrated with ELMIS. That's a feature that's coming. I wouldn't say which date it's coming in, but that would deal with the stock and anything that's to do with the dispensations. The ELMIS, the Health Information Exchange platform, will be dealing with that. That includes the daily activity register. So right now, SmartCare will not come with a DAR per se, because we are also looking at integrating with ELMIS to make our lives easier for all our health workers who are both SmartCare and ELMIS. That is that question. For the second question, which is cervical cancer screening. Yes, there is no module per se for cervical cancer screening in SmartCare, but in the ART forms, there is a cervical cancer screening data provision. And we also do have a provision in the family planning form, but the appointments, the SmartCare appointments, which are the today and pending reports, they will come with cervical cancer screening. If the client is due for screening, it will be shipped out with SmartCare Plus. And it will also be shipped out with the appointments also be shipped out if the client is due for EAC that day. So the additional things that we're adding to the appointments register is the survey, and if they're also due for.
Okay, thank you very much.
Just one last question from the Kapata team.
Thank you very much. This is Kampata, and I'm Mel Sarati on the call. So I heard the presenter talked of the integration. So last year we did an integration with Umozi, which is an appointment management system, the SmartCare Plus. So my question lies on the data warehouse. Thank you.
Okay, thank you for that. And it's just something I actually didn't even speak to, which was the synchronization of the global search, which means yes. To answer your question, yes, the warehouse, because we actually are conducting download and output sync. What does that mean? If there's a client in Kapata, or if I could just quickly show that, how it actually looks. Let me just share the screen. Okay, let's go back to the facilities. Okay, if there's a client who is in Kapata, and I'm trying to search for a client, let's say I'm in Chelmsford and I have SmartCare Plus. So I know that most of the facilities right now who are implementing SmartCare Plus will know that this doesn't work, the remote search. I'm glad to tell you that the remote search is working, which is what we're terming as a global search. That means when we search for a client from outside, you'll be able to, if you put all the demographic and unique identifiers for that client, you'll be able, and you find that client, you'll be able to sync that client's record to your database. Let's say, for example, somebody does not have a transfer. They've just moved out from facility A and moved to facility B, and you're pretty sure they are from a SmartCare Plus facility. You can actually search for them. You find them, and then we can sync the record. For example, this Aaron Sichivula you can sync the record, and then the sync will be the record will be in your facility. So that means that it's definitely synced to the National Data Warehouse. So that I hope that answers your question. For the Omozi.
Yes, sir, but I have a question.
Please go ahead.
Sir?
Before the question comes, please, are you able to remove the names, confidentiality issues?
No, these are not your clients. I did put a disclaimer. These are not real clients. These are from the test server.
Thank you.
Sorry, KB, Wani. I know that the discussion is very interesting, and I think that we need to have more sessions to actually break down and further discuss further on SmartCare Plus features, because these are just the tip of the iceberg. There are many more features that are aimed at making the life of an ordinary health worker like you and me better using this system. However, we are constrained by time, and I wish to, before I hand over to Dr. Ziambo, I want to acknowledge that we'll come and address the biometric issue later, but yes, there are provisions for this in SmartCare, both legacy and plus, but I think we'll deal with it conclusively in the next session that we'll be able to have. But just to emphasize that the global search is one functionality that will revolutionize the healthcare system in terms of patient.
I'm tired of waiting for.
And we'll also be able to deal with issues of passers-by, silent transfers, and trans-in, trans-out with much ease, in that the patient record will become one continuum from one facility to the other, so long as they are moving from a SmartCare Plus facility to another. So with those few remarks, I just want to say thank you to the HIV program and hand over to Dr. Ziambo.
Thank you very much. And this has sparked a lot of interest. I can see lots of hands. There was Sokoni, Kabata, and many others that whose hands have not responded to. We recognize that. Please accept our apologies. We had a limited time in which to do this presentation. But I think there's one question from the audience. They said, can we have a recording of this particular session, demonstration session? I think I'm putting out a challenge to IHM team. I think you may have to work on some short clips of video demonstrations or how to navigate this new SmartCare Plus 1.5, and just to help us and the healthcare workers to be able to just refer to it as where they are, because it's not possible in this time to be able to show everything. And we know that there will be teams going out in the facilities to orient, but not everyone will be oriented. So I think I challenge IHM, Dr. Miti and team, please do small demo videos that will be able to be sent out for healthcare workers to use as they interact with this system. Otherwise, we're very happy that you've been able to share this. Mr. Banda, thank you so much. IT team, thank you very much. Dr. Miti, thank you very much. And our participants in the network, thank you for giving up your lunch to listen to this. We appreciate your participation and your involvement. I think with those remarks, we've come to the end of the session. We'll be able to communicate further when we'll have another session on SmartCare. Have a good day.
Thank you, Chair.
Thank you, Chair.
Thank you.
Chair. Thank you, Chair.
Thank you, Chair. Acknowledged from Mansa.
Thank you.
Central Clinic. Thank you,
Thank
Chair.
you, Chair.